The study has been completed, has 70 patients on it in the relapse setting with Azacitidine Nivolumab. The overall response rate we see is about 35% for CR, CRI, and marrow clearance. We see an additional 10 to 11% patients who have very interesting and unique stable disease, where the disease never achieved remission, but they had more than 6 months with improvement in transfusion, outpatient, improved quality of life, which of course is very well known to be occurring with immune checkpoint therapy and solid tumors. So we think in general about 40 to 45% of patients had clinical benefit beyond what we would see in general with AML therapies. We also compared the outcomes of azacitidine nivolumab to azacitidine alone from our institution doing a propensity matched analysis, and we found that the response rates were about double with azacitidine nivolumab than what we would get with azacitidine alone. What was very interesting is that their patients who were first salvage seemed to have the best survival improvement. The median survival in the first salvage patients, majority of these being above 70 years of age, was 10.5 months, which is actually almost double of what we have seen and published from our institution and others have published with azacitidine alone. And we tried to find out the reason for that, and we were able to identify a greater degree, higher frequency, both numerically and percentage, of T-cell infiltration in the bone marrow in newly diagnosed and first relapse. After that, in subsequent relapses, the T-cell population seemed to get diminished, and in the third and fourth salvage was almost completely abrogated. And so it was very difficult at that point probably to get a T-cell immune response.